It's a new year, everybody. Happy New Year, everybody. I mean, it's so good to see you in 2025. So, we're going to be talking about how to improve your health as a woman using the FEM strategy. FERM, FEM strategy. So, stick around. Let's get right into it. So, we're going to be looking at F first. Can you guess? Yeah, F, food. Food. So important. So when we're talking about the F of the FEM strategy, food, what are you going to be cutting out and what are you going to be introducing? What are you going to be bringing in? By now, you know that if you're still on the path of junk food, you love junk food a lot. I know that by now you know you're on the wrong track. But then, this is an opportunity to make things right. A clean slate 2025. So how are you going to commit to cutting out junk food in your diet in 2025? I mean, you owe yourself this, you owe yourself this, you owe yourself that opportunity to get rid of that bad habit of taking junk food. So what are you going to be introducing? You cut off the junk food, ice cream, the soda, fried foods, a lot of fried foods, pastry, cake, pizza, all those. And then you're going to try to introduce proper home cooked meals. I mean, in 2025, tell yourself, I'm going to take a lot of home cooked meals as much as I can. I know the pressure of work and then the hustle and bustle of our ever busy life right now. But if you're able to make your home cooked meals, it's way better for you. You're sure of what to use, you eat at the portion you want, and then you're able to reduce the excess condiments that are detrimental to health. So that is a way to go. How about introducing eggs? How about introducing oats? Taking a moderate amount of vegetables, fruits. These are the things you need to be incorporating into your food for an impactful 2025. Also, remember to stay well hydrated. Hydration is so important for you because it gets your cells working together. How do you know when you're not well hydrated? How do you know when your body water is short? You may find out that you're not urinating and your quantity of urine you're passing out is reduced, and then your urine may be dark colored. Your urine should be a bright yellow, bright clear yellow. That is when you're well hydrated. And remember that on hot days and when you're sweating a lot, you need to take a lot more water. And then if your skin feels dry, not like the weather is hot and it's just so dry, you need to take a lot of water as well to stay well hydrated. So that is the F for the FEM strategy. E, exercise. Move those muscles, move those joints, move the body, get the body moving. You want to dance a lot this year, right? I'm going to be dancing a lot this year to get my body moving. And then if you're going to get into an weight loss regimen, weight loss plan, you have to ease into it. Work with your doctors. If you have any health condition, if you have a heart condition, or you have any issues with your joints, or you had a surgery, please work closely with your doctor and your trainer so that you get an exercise regimen that works for you and will not put unnecessary strain on your body and your joints. So the aim is to have at least 30 minutes exercise 3 times a week. But you know the problem, we want to get into it at the same time. We want to start lifting weights, we want to do the press up, we want to get on the treadmill, we want to do everything on the same day. So find out that you get tired that first day or that first week. So it's better to ease into it, and then you gradually increase your threshold, increase your strength, increase your endurance. It's better to get 15 minutes daily than to get 2 hours for 2 weeks and then you're done. What is the R of a FEM strategy? Regular health checks, regular exercise, regular health checks, I beg your pardon. Regular health checks. What do we want to be checking? Get your blood pressure checked, get your sugar levels checked. These 2 are important. And also remember that your breast examination too, monthly breast examination, self-examination, you want to make sure that after every menses, you check your breast to be sure that there are no lumps. Remember, why we are using the menses as a marker is that it helps you remember, and then hopefully at that time the hormonal effects of the last cycle are hopefully regressing, so you're able to examine your breast without discomfort, without pain. And remember that regular breast checks helps you know the consistency of your breast, so that if anything is off, you're going to easily identify that. So make it a habit to check your breast after every menses in 2025. Also, remember cervical cancer screening. Remember your pap smear checks. I'm going to be getting my pap smear this year, so I'm inviting you to also get a pap smear done this year. And then if you're able to get it done this year, if you use a conventional pap smear, that is going to be like you're going to get a repeat in 3 years. But if you use the human papilloma virus screening, HPV screening, that should be done every 5 years. So try to get a cervical cancer screening this year. Remember, if you're over 40, you should check your blood pressure and sugar regularly. And if you're over 40, you're doing a blood pressure check, sugar checks, just having annual health assessments should be the way to go, so that you're very much aware and in tune with your body. And remember not to ignore signs we get about in our body, our joints, our chests, and everything. So you really need to, have that sorted out. Then what is the M of the FEM strategy? This is not the most important, but it's still very important. Our minds. The mind is the seat of what happens about us. The mind controls our physical bodies. And remember that problems in the mind can also have a bearing and cause disease conditions in the body. So you want to declutter your mind. What has happened in 2024 remains in 2024. Were there disappointments in 2024? Leave them in 2024. Were there heartbreaks in 2024? Leave them in 2024. Were there financial strains in 2024? Please leave them in 2024. Declutter your mind. Take the load off your chest. Have a positive mental attitude and think the best of yourself. Give yourself a chance. Wherever you have locked yourself, your mind, to possibilities that you can be better, that something good can come out of it despite the mistakes you've made in the past, whatever stronghold, mental stronghold you have put yourself in, it's time to break out of that in 2025. Remember, you have a clean slate. So declutter your mind. Give yourself the chance to be a new person. It doesn't matter your age, you're 40, you're 50, you're 60. Give yourself the chance. And then repair relationships. Do you have a fractured relationship with your members of your family, your children, your parents? Repair those relationships. Remember that time is not promised. And then again, having a right relationship with God sets you on the path for a beautiful 2025. So if you're going to be applying this FEM strategy, can you say and type yes in the comment section? Thank you.